COVID-19 vaccines continue to evolve, testing is now happening on young kids, even babies. We spoke to infectious disease doctor Bernhard Wiedermann at Children's Hospital about it.
Dr. Wiedermann, of course, thank you for your time. Want to talk about Moderna announcing that they're going to be doing trials in children as young as 6 months old. So what does that mean, and what do those vaccine trials look like? What are researchers looking for?
Well, a great milestone in our COVID vaccine progress that we're able to start studies in children under 12 years of age now. With these younger children, we're not sure that the same dose that has worked in adolescents and adults is the proper dose of the vaccine to use in younger children. So they're going to be a small, probably several hundred children spread across the age groups to determine what's the best dose of the vaccine. And it may be, as you might predict, it may be that we don't need quite as much vaccine in a younger child as we do in the older age group. And depending on that, trials will then begin in a larger group of children to determine better how the vaccine works in those ages.
How important is this step to vaccinating children? Is it something that is absolutely needed to be able to get us to this place of herd immunity?
I think it's going to be much tougher to get to that sort of sweet spot of whatever percentage of herd immunity if the younger children aren't included. And the other thing to keep in mind, I mean, every day we hear new things about the variants and mutations, and can they spread more quickly? Will they behave differently in different ages? So we've got to keep that in mind as well.
And Dr. Wiedermann says another reason these trials are so unique is because a much smaller group of children need to be tested. That's because we already have so much information from adult vaccine trials. Now, both Pfizer and Johnson & Johnson also plan to soon have trials for children under the age of 12.